So hello everyone, and welcome to the Patient and Public Involvement virtual seminar. My name is Carolina Rusiak, and I'm a Trial Development Research Support Officer at North Wales Organisation for Randomised Trials in Health and Social Care, in short, NWORTH Clinical Trial Units. The session will start with a taster of what a clinical trial is, presented by Rachel Evans, who is the senior statistician at NWORTH. This will be followed by an introduction to patient and public involvement by me, which will then be followed by Karen Shepherd, who is the patient and public involvement representative and also a member of Park Bangor, which is within NWORTH clinical trial unit. She will tell you all about her experience, health and social care research. I will hand you over now to Rachel, and hope you enjoy.
Thanks, Carolina. So I think if I request control and then share my slides, I'm not sure how you... Oh, my request for control was not accepted.
Oh, I think you can share now. I think you can.
Okay.
Technicalities.
That's not a great start, is it? Sorry, guys. Let me know. Can you all see that?
Yes.
Okay, great. So thanks, Carolina. My name's Rachel Evans and I'm a senior statistician at NWORTH Clinical Trials Unit, which is based in Bangor University. Today, I'll be quickly talking to you about who or what is NWORTH, what a clinical trial is, some common terms that you might come across when discussing clinical trials or reading about them, and some considerations for clinical trial design. So firstly, who is NWORTH? So as Carolina mentioned in the introduction, NWORTH stands for North Wales Organisation for Randomised Controlled Trials in Health. Basically, NWORTH is a clinical trials unit based in Bangor, and we are registered with the UK CRC network. Across the UK, there are around 47 different trials units registered with this network that all work on different research studies. So within NWORTH, we have different functions such as clinical trial statistics with quality assurance team, information and technology systems team, trial management, data management, and other kind of clinical trial unit admin, etc. So some studies that we work on a variety of studies on our portfolio, some dementia trials, we have dentistry studies, we have some clinical trials on borderline personality disorder and psychosis. We have some cancer trials such as bowel scope cancer. We also work on some randomised trials of people with addiction to alcohol and drug substances. And they're just some examples of the active studies we have at the moment, but we've had a variety over the past. So I'm sure you all have heard of COVID and COVID-19 in the news and social media, etc. It's kind of hard to get away from it at the moment with all the rules and regulations. But hopefully you would have also seen some news about the COVID research. So at the moment, especially this week in the media and the news, there's a lot about the vaccine trial and some positive news from that. There's also a lot in the media about the COVID treatment trial. So for example, the recovery trial, which is run, I think it's down in Oxford, and the prevent trial, which is Wrexham. At the moment, from all current research in the UK, 60% of COVID trials involve a clinical trials unit. So it's well established that clinical trials units are very important in the current pandemic research and in also other research. But what exactly is a clinical trial? So a clinical trial is a medical study or research studies that involves people. We look at different medical interventions or medical treatments, surgical devices, behavioural therapies or different treatments. And essentially, basically, they test whether one treatment is better or at least as good as another treatment. So this tends to be a new intervention or treatment method against the current method of treatment. Or in drug trials, it could be a new medicine or drug against a placebo. From all the kind of medical and treatment that is used in the NHS and anything recommended by NICE guidelines will have gone through a clinical trial before it's implemented to test its effectiveness. So just some uses of clinical trials. So as I mentioned, then they can be used for new medications or new drugs. They can also be used to evaluate current drugs that are used in other areas, so in a different disease area. A clinical trial might assess a new method of administering the drug. So if you want to evaluate whether an injection format is better than a pill format, for example. Clinical trials can also look at new therapies or existing therapies in other conditions, and they might look at methods of delivering therapy. So a therapy might be established one-to-one, but they might want to look at whether you can do it as a group therapy or an online therapy and still have the same benefits and effects. Clinical trials can also be used to evaluate alternative medicines, so such as vitamins or herbal remedies, to assess their effectiveness on conditions. So there are several phases of clinical trials. The common phases are phases 1, 2, 3, and 4. So I'll quickly summarise what these phases mean. So the phase 1 trials tend to assess whether the treatment is safe or the medicine is safe, and look at any side effects or adverse events in that population. Phase 2 trials evaluate whether the medicine or the treatment works on a specific condition or disease. They also are used to establish the effective dose or regime of the medication. Phase 3 trials are your typical randomised controlled trials, and they evaluate whether the treatment, the new treatment or the new treatment is better than the current treatment, or at least as good as. Phase 4 look at the long-term side effects of medications. So within research, there is something called the research evidence hierarchy. And this is basically a framework which is used to rank or order research designs based on the type of research that it is and the methodologies that they use. So the higher up the pyramid, the better the research design is perceived. Randomized controlled trials, which is the blue section in the pyramid there, sit at the top of the evidence hierarchy just below systematic reviews, and they are referred to many and known as the gold standard of clinical trials. I should note that there is a lot of controversy around this pyramid. So many researchers, including myself, argue that we should also take into account the quality of the research, not just the design or the type. But at the moment, randomized controlled trials are established as the best for interventional research, evaluating different interventions. They should also be accompanied by qualitative research, such as process evaluations or implementation research too. So I mentioned there that randomized controlled trials are the gold standard of research, but what exactly is a randomized controlled trial? So it's kind of in the name, given that there is the randomization element where patients within the studies are allocated to receive a specific treatment by a randomization algorithm or a computer. So participants are placed to receive either the intervention or control, and the randomization algorithm or computer can account for certain factors that might influence the treatment or the outcome, such as gender, age, or disease severity. So the participants are allocated to a group and data is collected from them at baseline. They then receive whichever treatment they were allocated to for a certain time period. And after that treatment has been conducted, they will gather data again at the follow-up for the participants. And differences at the follow-up are analysed, and any observations made or differences seen are attributed to the treatment that they had. There's some common terms that you might hear or see in clinical trials. So adverse events, which are undesirable effects noted during the study. So this could be attributed to the treatment, but it's not necessarily caused by the treatment. So for example, it could be a rash or a headache or dizziness, but it could also be something by getting hit by a bus or falling over and breaking your leg. Randomization, as mentioned previously, that's the process we use to allocate patients to a treatment group to ensure they're as similar as possible. Bias in clinical trials is a systematic error caused during the design or the running of the trial, and it has an impact on the results and it essentially makes the results unreliable. So there are many different types of bias in trials and many different types of ways to minimize them. So researchers, because of the impact on the results and conclusions, the researchers and investigators should always pay particular attention to bias and try to minimize it wherever possible. One method of doing this is blinding, which refers to whether the patients, researchers, or clinicians know which treatment they are receiving. So, for example, if you knew you were receiving the treatment, you might psychologically feel better than you would if you knew you were receiving control. So to account for that bias, we use blinding, so patients don't know what they're receiving. And an aspect of that is placebo. So a placebo is a drug or pill which is designed to be harmless and ineffective, but looks, tastes, and smells exactly like the active treatment. And this helps with blinding so that patients don't know what which treatment they are receiving. Side effects are similar to adverse events, but they are attributed to the treatment this time. So it's a rash or a headache or nausea as a result of taking a certain treatment or medication. So lastly, I'll just finish up with some considerations for clinical trial design. So as with any research, the most important thing is the research question. So why are you running your trial? What do you want to find out from conducting the clinical trial? Usually this is whether treatment A is better than treatment B. And again, similar with research, you've got your PICO, so your population, who are you running the trial on, what age group, what gender, what ethnicity, etc. The intervention, what are you testing? So what's your interventional treatment? Is it a medication, a therapy, a surgical device? Your comparator, what are you comparing with? Is it treatment as usual, or a placebo drug, or something else? And you've got your outcome. And your outcome is a measurement which we use to analyse the differences between the groups. So, for example, in the vaccine trials, it would be whether the patients obtained or received the disease. In cancer trials, it might be survival, so whether the patients die or survive. And in many other research studies, it's some continuous measurement scale where participants complete questionnaires based on their kind of experience and their symptoms of the disease. Other aspects to consider for trial design is your sample size. So how many participants do you need in the trial to evaluate what you're aiming to evaluate? You've got data collection. So what data are you collecting, when are you collecting it, and how are you going to collect it? Similarly with your analysis, how are you analysing, what are you analysing, and when are you going to analyse? And then your dissemination, so how are you going to get your research results shared and published to the research community? So that's it from me. I hope you enjoyed that presentation and it gave you a brief overview of clinical trials. I'll hand over to Carolina to talk about patient and public involvement in clinical trials, and then Park Banger. So thank you. If you have any questions, I'm happy to address those at the question and answer session at the end. I need to stop sharing now, don't I, Carolina?
Yes, please.
How do I do that? All my IT skills are being tested here.
If you go to a little window where you can see yourself at the bottom, you can put on the cross. It's like a. Let me see if I can just request control.
Oh yeah, there you go. Did you get control back?
Okie dokie. Can everybody see the patient and public involvement presentation? Fantastic. So thank you very much, Rachel. I will tell you all a little bit about patient and public involvement. We usually use the abbreviation PPI, so not to confuse with the whole insurance claim stuff, but it's patient and public involvement. There we go. So what do we mean with patient and public involvement? Who are the public? By members of the public, we mean all of us who use health and social care services. For example, patients and carers attending a hospital appointment or possibly within the community. What is involvement? As defined by the National Institute for Health Research, involvement is where research is carried out with or by members of the public, rather to, about, or for them. It focuses on providing patients and the public with opportunities to directly influence the research process. Patients and the public can get involved in all stages of the research, from identifying topics, defining the outcome measures, evaluating the output, as well as communicating the finding. So you're not collecting data from them, but rather with the public. Participation is different to involvement. Participation is where people take part in a research study. For example, this could be researchers or clinicians or together. They may be collecting patient data from a questionnaire or during an interview or a treatment. And those two are different again from engagement. This is where information and knowledge about research is provided and disseminated. This is where patient and public are involved in writing research papers or attending conferences to present research findings. And there are many more opportunities to get involved. Of course, it is possible that one person can be involved in all of them, especially if they are involved in writing a research paper for one project, but they are also taking part in a different research study. And again, they could be engaged and going to a conference for a third study. So it is possible for them all to overlap. However, today we'll just focus on involvement. So why is patient and public involvement important in research? The public provides a different perspective from the rest of the research team by, for example, having used a particular service or they went through a particular treatment. The public is able to provide their experience and insight. And this experience and insights has the potential to improve the research quality and relevance. And this is important, especially when the public can help with the research question. Is the research question relevant to the given population? Is the methods are acceptable to the given population, targeting the right population and the services with the research. The UK standard for public involvement are designed to improve the quality and consistency of public involvement in research. So there are standards that we follow, or within the clinical trial unit that we follow. And these standards are for everyone doing health and social care research. And they provide guidance and reassurance for users working towards achieving their own best practice. You can find more information on their website, which I will provide later on in the chat. Okay, if you decide that you would like to get involved in research, these are some of the things that you might be asked to do. So you might be asked to make sure that researchers ask the right questions and in a way that the public understands. So there is no research jargon or research or medical terms, it's just clear what it asks for. You might help researchers design their projects or develop understandable information sheets for people taking part in research. This could be questionnaires or a consent form. You might join a research management or advice group to oversee the projects or advise. You might help interpret the results of the research, as well as make sure that the research that is supported is understandable to everybody, not just the research community. And you may help make sure that good research is heard about. being it virtually, at a conference, or in the community. So what kind of benefits of being a patient and public, so what are kind of benefits are there for patient and public involvement representatives? First of all, keeping those involved with research in touch with the real concerns and problems of real people, not just the research researchers want to do, but focusing on what is actually needed. Making patients and the public priorities have more of an influence on what gets researched and how. Using your own experience to ensure the voices and experience of patients and healthcare service users are heard. Individuals will have first-hand experience, having went through a treatment or something, and that voice is important to be heard. Empowers those who wouldn't normally get a chance to have a say. Contribute to the healthcare system in a meaningful way. Play an important role in actually improving the services. And of course, there is also funding available to reimburse PPI contributors for the time and travel expenses. Travel expenses maybe not during this COVID time, as we're doing everything virtually, but definitely there are vouchers provided or some kind of form for their time. For more significant or specific contributions, training may also be provided or paid for. Develop your skills and knowledge in healthcare and clinical trial research. And last one, make some valuable networking connections. So you're able to meet with others, communicate, get together, but I'm sure Karen will tell you more about this. So how can you get involved? Here locally, we have, as Rachel mentioned, the Park Bangor group, which is located within NWORTH Clinical Trial Unit. Then more nationally, so in Wales, we have Health and Care Research Wales. And across the 4 nations, we have the NIHR Involve, which is the National Institute for Health and Care Research. And this is across Scotland, North Ireland, Wales, and England. So this is our welcome page for Park Bangor on the NWORTH site. So if you want to find out a little bit more what it means to be a member of the group, please do visit the site. You can also join. We have a Join Park Bangor form there, and you are able to contribute in many ways to different clinical trials. And Karen will tell you all about what she has been involved in. Then Health and Care Research Wales across Wales. So Health and Care Research Wales is a network organization supported by the Welsh Government, which brings together a wide range of partners across NHS in Wales, universities and research institutes, as well as local authorities. But this is just in Wales. And they have a lot of information about public activities, taking part in research. They also provide training. So if you are interested in anything, please do go on their website. And the last one is the National Institute for Health Research, Involve. They support public involvement in the NHS, the public health and social care research. It is one of the few government-funded programs of its kind in the world, and they have a great frequently asked question section where you can find out a lot about getting involved across all 4 nations, but also, you know, what it means. There are some training opportunities. So please, I will include the links to all those sites in the chat towards the end of the presentations. So thank you very much. And I will hand over to Karen now. I think
Hi, am I on?
we're
Hello, my name is Karen Shepherd. I live in Buckley in Flintshire with my family. For the past 20 years, I've worked as a teaching assistant within a special needs primary school, or School Pencoch in Flint, working primarily with children with autism and living with complex health conditions and behaviours from foundation level through to Key Stage 2. I'm also a carer for my son who has autism, and he's now 31, but he still lives at home with us. My passion for research stemmed from when I was diagnosed with Parkinson's, age 49, in 2009. Initially, I was in shock, and devastation soon followed rather quickly. Having very little knowledge of Parkinson's and just the stereotypical image of an older person with a tremor, balance issues, and speech problems, being increasingly dependent on others, left me struggling to come to terms with what this meant for me personally, but also for us as a family and for the future too. I was advised by my neurologist to go and Google it. Most of the information was very negative, left me struggling with my self-esteem and my confidence, and I felt totally isolated. It was a few months later before I plucked up the courage to go online again, taking the pathway we had followed when my son was diagnosed at 3 with autism. We looked to the research network. The Parkinson's UK Research Network was a great source of positive information and advice, and it was the first time I was able to find practical information and support on managing the daily issues living with Parkinson's has, but in a positive and a constructive way. It was important for me to gain information and knowledge so that I could better understand my Parkinson's, so that I could be better meet any challenges I was facing now and in the future positively and take back control of my life for myself. Importantly, it gave me access to peer support and extended knowledge from people with Parkinson's who are already on the Parkinson's journey. I joined the Parkinson's UK Research Network. I accessed training on different aspects of research. I gained experience reviewing documentation, pre-publication, and reviewing grant applications from a patient perspective, as well as helping with the professional development training of pharmacy technicians, and giving a presentation on my personal story with Parkinson's. It was received very well, and I felt that I'd made a valuable contribution to the training and also to the wider community. During the last 5 years, I've continued with my Parkinson's research by sitting on the International Discovery Award panel with Oxford University and the Policy and Campaigns Committee of Parkinson's UK. Research has given me the most valuable experience of working alongside researchers, clinicians, ologists as I call them, policymakers, therapists and other members of the public. Gaining valuable knowledge and encountering differing viewpoints to my own. I've gained greater understanding of how open lines of communication and collaborative working practice with an enthusiasm and determination to succeed in research can actually build positive and supportive networks to ensure quality research outcomes for all. Everyone, whatever their profession or circumstances, have life experiences and relevant opinions and thoughts to share in development of and securing better health and social care services, as well as improving the quality of life for the whole population of North Wales across all the generations. As my enthusiasm for research grew, I found it difficult to identify research opportunities here within Wales. So again, I went online and found Healthcare Research Wales, and I became an active member, receiving weekly newsletters, research opportunities and training resources from across Wales. I've helped review grant applications from a patient public perspective. I've researched research outcomes for the exercise referral scheme for Welsh Government, and I'm a lay panel member for the PhD Studentship Grants Committee. I was invited to give a presentation at the Have Your Say in Research event being run by the NWORTH Clinical Trials Unit in Bangor University, as their focus on promoting visibility of research in general, and in particular, the importance of public and patient involvement in research, specifically within North Wales. Following interesting presentations on the programme, which included researchers, Healthcare Research Wales representation of their work, and Professor Paul Brocklehurst, Director of the NWORTH CTU, I was so impressed by their openness and their enthusiasm in their work, I signed up and I became a member of Part Bangor. I've learned a great deal as a member of Part Bangor PPI group, most especially the true value of open communication and information sharing between public members, healthcare professionals and researchers. We are all recipients of health and social care services for ourselves, our families, and also within our working environment. It's apparent that the best quality research outcomes actually come from listening and sharing lived experiences openly and honestly together, and utilising knowledge and understanding proactively. Over the past 10 years, I've gained confidence and increased self-esteem through working as part of a multidisciplinary team, both at local level here in Bangor, but also at board and national levels. Part Bangor PPI membership is representative of the whole population of North Wales, from the Isle of Anglesey in the north to the Llŷn Peninsula and the Gwynedd in the west, the northern coastal towns to the rural areas of Denbighshire, as well as the industrialised northeast and Wrexham. Each has a unique demographic demand that everyone within that population of North Wales has the right to have their views and needs listened to and ultimately represented in further developing and improving service provision in their local areas equally. It is an eye-opener to see the variances in healthcare and services provision within North Wales alone. As a newly formed PPI group, we have embedded the 2019 National Standards for Public Involvement in Research into all areas of our work, ensuring that the public and patients are adequately and equally supported in their involvement in research, ensuring their work is measured and valued and embedded into our future work. We've all contributed to the development of our communication plan and to the group's terms of reference. Meetings are also held in the mediums of Welsh and English, and we ensure research accessibility for all. Last year, I represented North Wales in Cardiff as part of Healthcare Research Wales Steering Group to organise celebration of public and patient involvement in research. It was an exciting and insightful experience involving discussion groups with Welsh Government policymakers, health and social care leaders, third sector representatives and researchers, all ably supported by the team of Healthcare Research Wales. It was good to see the population of North Wales represented, and we secured 2 research events, one in the National Museum within Cardiff and the other at the Storiol Museum up here in Bangor. There were 2 different styles of event, but each reflecting the needs of their respective venues and the population needs. At the core of both events was the interactive stands with engaging content for all the family and TED-style talks from local researchers and public and patient representatives and activities for all the children. Both events benefit from having a regional bias, both reflecting and interacting with the audience rather than just a national one, and I think it contributed greatly to the event's success. The interactive stands were a great source of information and brought whole families into discussions and gave members of the public the chance to meet live researchers, realise they are actually human too. I have gained valuable insight into social care research especially, and I became a member of CADA, which is the Centre of Ageing and Dementia. I have had the opportunities to meet and discuss via face-to-face presentations, but post-COVID, it's by online forums and cafes, ongoing research here in Wales from the comfort of home. Part Bangor has fed my passion for research and continues to do so. It has opened up my eyes to all the different types of research. It's given me the confidence to question and to understand and appreciate that my views and input of all our members at Park Bangor are valued and deemed important. I've taken part in a clinical trial and had training in qualitative analysis. I'm made to feel like a key member of the team. The most important thing that I've learned is that we all have a role to play in securing meaningful research for the future by coming together as one in a supportive environment, sharing different perspectives, but with a common goal. Meeting others willing to give their views and support for each other, whether we're health professionals, care workers, members of the public, will secure the quality research outcomes that people in North Wales deserve. Even COVID has played its part in advancing and enhancing research throughout the pandemic. I've always considered myself to be a technophobe, but digital technology has improved access to research. It's also improved communication for those who are usually more isolated and kept information going throughout the pandemic via Zoom, Teams and Skype, of which I'm now quite experienced at. It is empowering to see that my expertise is equal to that of the professionals. As future graduates and future members of the health and social care sectors, I believe this is a great time to consider becoming members of Bangor Patient and Public Involvement Group. The opportunity will enable you to become part of a wide and varied networking community here in North Wales and beyond. All professional members have all been where you are today. All the public community members have a wide, varied lived experiences for you to share in, and your contribution to discussions will bring a younger generation element to this exciting new era of research and taking us into the next decade. I'd just like to say thank you, each one of you, for taking the time and enabling me to share my experiences of research, and more importantly, of my membership of Park Bangor. Thank you for considering joining Park Bangor, and if you have any questions, it'd be a pleasure to answer them for you. Thank you.
Thank you very much, Karen. It's always lovely listening to you. I will try to see if my camera works again, hopefully. Does anybody have any questions for Karen, Rachel, or myself? Karen, can I just ask you, how much of your time does PPI and Park Bangor involvement take up?
It's varying. It's what you want, how much you want to get involved with it, really. It can be as brief as just reviewing a couple of documents, which is just making sure it's friendly for the public to understand, clearly understand it. Or you can get more involved if you want to take a more active role in it. It's very much personal choice for you at what level you want to come into. Can I just say as well, if you join Healthcare Research Wales as well, as you said in the presentation, that you can get a lot of support and access pre-training on all different aspects of research. But also, there are different levels of involvement that you can do. So it's you have the choice. It's up to you, the personal choice to how much time commitment you want. I mean, personally, I love research. I love it, and I do as much as I can. For me, I just want to secure better things for North Wales and have our voices heard when they're discussing research grants and applications. Yeah.
Thank you, Karen. I think there is a hand up. Is this Greg?
Hi, yeah, it's me.
Hi, Greg.
Hi. So Karen, thank you very much for your presentation. It was really insightful. I just have a quick question for you. What do you think makes a PPI group meeting run well? What do you think is important for the events?
I think you need to have a good understanding of the local area. So for us, it's all across North Wales. So it's quite a broad membership, like I said in my presentation. It's having good communication package, so that you, like through COVID, we've all managed to keep in touch to one relevant degree or another, and making sure that everyone has a chance to have a say in research. I think for me, it's understanding what research is about and understanding the local area's needs, but more effectively is to get good communication and make sure that research gets to the places across the whole of North Wales. Because like I said in my presentation, I found it very difficult initially to find out what was happening in Wales, and there's so much brilliant stuff going on, but it's almost in like pockets across the region, and I think it's important that we get more maybe members of the health and social care community involved in Park Bangor, as well as general members of the public, because I think there's a great need for the input from people who work within health and care, health and care, to reflect on both personally that the experiences they have, as well as probably personal experiences. So I think communication is a massive importance. Yeah.
Great, thank you.
Sorry, I've just been putting up some stuff in the chat. Karen, the comments in the chat are saying very inspirational. I'm not sure if you can see them. Very enjoyable.
Thank you. It's my very first one as well, so.
Fantastic. No, very good. One more question for you, Karen. What kind of support have you received, or do you receive with your work, with your PPI work?
I have excellent contacts at Park Bangor. Anything I'm involved with, the Karen in the office is brilliant, as well as the researchers. Once you get to know them, you have the communication between them, the emails are straight back to you. I belong, like I said, to Healthcare Research Wales, which I would say is, if you're not sure about research, is register with them, because you will find out about all the training and information. It's very much on a personal basis. So if you only want to do a certain amount, you can do it. Some of it's all online, so you can do it from home. I've just found support has been brilliant. And the more you get to know people, the more you get involved, the easier it is. Any questions, you get directly in touch with Park Bangor or straight through to Healthcare Research Wales. And they're very supportive. If there is anything where you need to travel, or if you need to stay overnight, pre-COVID, shall I say, they will sort it all out for you. It's all sent, and expenses and stuff like that, should they arise, are all very straightforward. They must be, because I can do it. So, you know, I'm quite new to all this online stuff, and I found the support is amazing, especially with the video conferencing facilities as well. But there is plenty of information, and like I said, the communication support Park Bangor is excellent. You know, can't highly recommend it.
Oh, thank you, Karen. Thank you. I have one question here from Alison. She wrote, I suppose it isn't just the medical side of research that patients and public can help with, reporting of symptoms, etc., but also the social and psychological side. Do you find that input from different perspectives allows for a better outcomes?
Yeah, I sit on some other groups as well. I represent patients on the neuroscience board as well as this research. And it's amazing how much clinicians see their perspective of treatment and how things are going when you relate to what's actually happening, like a ground level, as I call it. And if you get people in the same room together and you all have a conversation and have an open conversation, they do see a different perspective to anything really in a lot of sites. And I think in research generally, it's starting to be aware of how important the qualitative side of research is. It was always like quantitative, which is the data collection and all that, but for patients and for public members, it's important that the other hidden areas, shall I say, that affect people with their health and their social care are also addressed. But I think there has been a lack of maybe social, and within social care especially, I think it's important that the qualitative side of things are represented. And I think the more isolated groups of patients and the public members out there, that's where their strength is, because they need someone to speak up for them. But I do think up in North Wales, we are, because we're a relatively new group, Park Bangor, up here. My experiences, I was quite shocked really to how well versed they are in the qualitative side of things, and they take a lot of care. If you get involved, I've seen a lot of care in the bits of the research I've taken part in, and how much they have dedicated to taking on board the qualitative side of it. So I think we're doing quite good up here. In reflection, when I have been down to Cardiff and seen it there, it's starting to come in, but I do think we're ahead, shall I say. We're getting there.
Yes, definitely we are. Thank you very much, Karen. Can I just ask Greg, do you have another question, or is this just from before the hand is up?
Yeah, I do have another question for yourself, Carolina, or for Rachel, and it's from, if you were planning to do a research project, when and how should you start planning PPI input, and how do you go about actually contacting people to get involved?
So when you, please Rachel, fill in anything that I miss out. So you should start finding PPI you can through Park Bangor, through the links that I provided to you, or Health and Care Research Wales. They have a bigger registrar and can provide you potentially with the right information depending what kind of area you're looking for. And you should involve PPI as soon as possible with your question, really. What is the question you're asking? Is it right for that particular population? Is it right for a particular service? As early as possible. And then throughout the whole project till the end, till everything is written out, till everything is published or communicated in some form virtually or at a conference. So yeah, from the beginning to the start. I'm not sure if Rachel has anything to add.
No, you've covered everything there.
Are there any other questions? This is Alison. Yes, Alison, you can join as a student nurse. Anybody is very welcome to join. I've included a Park Bangor registration form in the chat, so please do fill it out and send it to me, or send it to NWORTH@bangor.ac.uk. Anybody else? Okay. Just share this. Okay. Thank you very much, Karen and Rachel. Thank you also for those who attended the seminar today. A recording will be available on our website. If you have any more questions, please email me or please email to nworth@bangor.ac.uk. If you have any questions for Karen, you can also email me and I can forward it to Karen or Rachel. Yes, is there anything Rachel and Karen would like to add?
No, just thank you, everyone. Thanks to Karen for your talk, and thanks to everyone for joining.
Yeah, thank you very much for all listening to me anyway.
Thank
you.
Thank you very much, everybody.